My name is Dr. Kit Langstroth, and I've been a practicing chiropractor for over 22 years. The reason I became a chiropractor was because I had several injuries to my neck and back that almost left me paralyzed. I want to tell you something. Back pain can be a very miserable experience, and it can affect every part of your life. So what we want to do is find out why you have the problem and use the best means available to fix it. Now, some of you have easier problems to fix, and some of you more complicated and difficult. In order to find out what your problem is, we have to start with a thorough examination to do this. And I feel that many doctors are not doing this properly. For example, is the problem coming from a nerve root? In that case, we can see if you have weak muscles in your leg or a loss of sensation in the leg that is directly associated with a specific nerve in your low back. We then know where your problem is coming from because the nerves go to the muscles and allow for the muscle to function. Finding weak muscles in the leg are important to isolate because strong muscles support the pelvis and weak ones don't. This can contribute to back problems. Is the pain coming from the facet joints or the sacroiliac joints in the pelvis? The facet joints are located in the back part of the spine, and as you can see, it forms a joint when two vertebrae move. When the bone is out of place, what will happen is it'll create grinding and inflammation in that joint. This can be a very easy fix. The sacroiliac joint is formed between the pelvis and the sacrum, and here's the joint. If the pelvis is out of place or it's rotated, it can create inflammation in this joint as well, and this can be very, very severe pain. It can even radiate pain down the leg, for example. Is the problem coming from a disc bulge or herniation? Disc problems do exist in many chronic low back pain patients, but don't worry because a lot of the things that we do will address this. X-rays are also important for two reasons. They will tell us specifically what structural imbalances or misalignments you have so that we can make a more accurate correction, and this will speed up your recovery. Second, it will tell us how bad you really are. So what's the solution? There's 7 things that I have found that will really help your back. Number 1, specific alignment techniques. The more specific we can get in aligning the spine, the better the result. For example, if the bone has gone out of place in this direction, then we want to be as specific as we can to make that correction and align it. We also have to look at the big picture. In the following illustration, you can see how imbalances in the feet can create stress in the knee, hip, and ultimately the low back. We have to address these areas too, or the low back problem will often keep recurring, and many doctors simply ignore this. Number 2, a back strengthening program, where we give you some really good back strengthening exercises to complement or help the alignment hold a new position. But in more serious cases, we recommend an extensive and comprehensive Pilates-based rehabilitation program designed to completely retrain your movement patterns and your core strength. Those are the muscles that support the spine. Number 3, we also have deep tissue massage for muscles that need hands-on deep tissue work for old injuries or damaged muscle. This can be a very effective tool in helping your condition. Number 4, brain-based therapy. This is for the more difficult case where pain stems from the central nervous system. These are painless techniques that we use to help the most difficult cases. A more detailed discussion of this is under the brain-based therapy section of this website. Number 5, clinical nutrition and diet counseling. Improper diet can contribute to inappropriate inflammatory processes that can contribute to chronic pain. If we can identify your bad eating habits, we can further help you. Clinical nutrition deals with analyzing blood, urine, and saliva testing and making recommendations to change your blood chemistry. Sometimes the things that are going on inside your body can also affect pain. If there's a problem, we'll find it. Number 6, cardiovascular exercise. A lot of people stop exercising because of the pain. Once we get you feeling better, we want you to graduate into some form of exercise you can do on your own because studies have shown that individuals who do this have less pain. Number 7, oxygen enhancement therapy. This can be very helpful for the more difficult and chronic cases as well because the brain and nerves need fuel, which is oxygen, to help calm those pain signals down. So as you can see, we have a very extensive program set up for people who have back pain. If you're having back pain, pain down the leg, numbness, or you're not sleeping well, then call me. What I've found is the longer you wait, the worse it can get. I really want to encourage you to make a proactive change so that you can get your life back. Come in for a free consultation and talk to me, and I'll find your problem. God bless.